So, after a sprain, some may not have the money or the time to see a doctor immediately. How
Mhm.
can one know if the injury requires immediate attention?
The best thing that can guide a patient on whether they urgently need to see somebody is the amount of swelling and bruising. As I tell patients, the reason you have a bruise or what we call ecchymosis is that's tissue tearing. The more bruising, the more ecchymosis, the more swelling, the more pain they have, the more urgent they need to be seeing a foot and ankle specialist or a surgeon for urgent evaluation. If you slip and miss a step, you feel a little twinge, you're like, oh, I think I rolled my ankle, you have a little bit of pain, not significant swelling, not significant bruising, that's the time to implement a simple RICE protocol is what we call it, which is rest, ice, compression, and elevation. That's pretty universal for all soft tissue injuries. If you're not feeling drastically better in the next 2 to 3 weeks, you need to call a specialist.
Now, what if they do have an increased amount of bruising and pain, but they're able to walk on it? Should that still be a sign of concern?
It would be a sign of concern. I meet a lot of patients, especially younger ones, because they're able to tolerate a lot more. Less than 10 days ago, I fixed an ankle on a 20-year-old kid. He rolled it, landed on a friend playing Frisbee, didn't think of anything of it. His mom looked at it, he's like, whoa, that's really bruised. 3 of his ligaments were ruptured. He needed to be fixed. He was like, I can walk with no pain, but if I go to move or do anything, higher yield or turn or struggle with stairs, I have a lot of pain. But just walking, it's, pretty lax and pretty straightforward. I don't have an issue. That can be common in patients because it's until you start to strain the tissue that's no longer there, you're going to be fine. The best analogy I use for patients is your ligaments around your ankle, they function as a seatbelt. You can drive your car without a seatbelt and be fine. But when you hit somebody and you don't have your seatbelt on, you're going to have a big issue. And so it's the same thing for the ankle where it's like, you can get around and you can skate by with no ligaments, but you're going to have an issue when there's that, oh darn moment where something bad's going to happen.